Hey everyone, so today let's talk a little bit about CSF rhinorrhea or CSF leak. So what is the CSF leak? So it is just a communication between the intradural space and the pneumatized air sinuses. So this communication can be through these three pathways. It can be either frontonasal, it can be frontoethmoidonasal, or it can be sphenonasal. So frontonasal is called direct and frontoethmoidonasal or sphenonasal is called indirect. So thus it can be classified into either direct or indirect. So let's talk about the clinical manifestations of CSF leakage. We already know of these two very common tests. The handkerchief test, we know that the nasal secretion, it does stiffen the handkerchief, whereas CSF leakage, it does not. And the most common and the most common sign, that is the halo sign. So what is that? It is generally found on a sponge, swab, or even a handkerchief, in which the liquor border forms around the blood stain. This happens only in CSF leakage. In regular nose secretion, it does not. And now this is the other test you should all know about. This is called the Quickenstead test, in which if you press the jugular vein, it raises the intracranial pressure, which results in increased CSF leakage. So these are the tests which are generally seen in CSF leakage. So now we already know the chemical diagnostic test, which is the glucose and protein test. So in this, we know that glucose and protein is found in a higher concentration in the CSF rhinorrhea than the nasal secretion, although this is not the gold standard. So better tests than the glucose protein test are these two, the immunological tests, which are the beta-2 transferrin and the beta trace protein. So beta-2 transferrin generally is a very good test to diagnose CSF rhinorrhea, CSF leak. However, there is a 3% chance of the test or the results being false negative. So an even better test than beta-2 transferrin is the beta trace protein test. It has a higher specificity than even beta-2 transferrin. So this is probably the best test.